This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Good evening and greetings in the name of our Lord Jesus Christ. The fact that you can listen to this voice, you can see this image, we want to thank God for the life He has given us to see the beauty of this day. And I believe that the fact that you're tuning in Church of Uganda Family TV, you have made the right decision. You have made the right choice because what we are about to talk about is really very, very important. Edrine Mukalazi is my name, and I and the team, we welcome you to today's edition of the Family Hour. Today, every Tuesday, we look at family health. And of course, today is another episode of family health. Today, we want to look at dental caries. And of course, by the end of this show, I believe that you will have understood, especially what you need to do to prevent. Because remember, prevention is better than a cure. With us is Dr. Katsina Joseph from Mengo Hospital. Doctor, it's a pleasure having you this evening with us here.
Thank you very much. It's a pleasure being here myself. Good evening, viewers of Family TV. I'm very glad to be here, and I'm very glad to be talking about something I'm passionate about, especially dental health, oral health, also, most importantly, public health and health promotion. And knowing this is Family Hour, and the family is the most, I think is the most fundamental element of our society. And also being on Family TV, a Christian television, I think it is such an honor to be here, because actually one of the foundations or the facets of our mission in Mengo Hospital is bearing Christ witness. Well, we give quality health services, all these, but bearing Christ witness. And it's such a pleasure and an honor to be in this place today to talk about one bit about the so many topics in dental health, which is dental caries.
We are excited to hear from you. So, talking about dental caries, Doctor, what are dental caries, or how can you describe dental caries?
Dental caries, I think in literature, one of the earliest literature, I think it is from around 5000 BC. And I think previously it used to be known as the tooth worm. And I believe even in our local languages here, it is, most times it is still translated as the teeth worm. Yes. Yes. However, later it was termed dental caries. I think the earliest literature about the nomenclature of caries is in the 1600, and caries actually comes from a Latin word that is decay. So decay is what we commonly know as tooth decay. Your tooth is decaying. Yeah, and so basically dental caries is your tooth starting to decay. The progression and the processes and everything that happens, it's a process, but at the end of it all, it is termed as tooth decay.
Okay. So someone would really want to understand what causes this decay.
What causes tooth decay actually? In fact, previously tooth decay was considered like a tooth infection, but I think in the 72nd World Health Assembly in Switzerland, that was I think in 2019, actually tooth caries or dental caries was categorized as a non-communicable disease, surprisingly. And the reason why is because most of its causes are almost in line with the causes of other non-communicable diseases. And now, what causes dental decay? Most of these are behavior mostly, dietary. By behavior I mean what we eat. Then our oral hygiene. There is, of course, a bit of genetic predisposition that all our teeth are not the same. There are people who are more prone to decay than others. However, the most key issues are dietary and behavior. Now, by dietary, I mean if our diet mostly consists of sugary substances, easily fermentable carbohydrates, anything that is sugary that we eat, and there's a misconception that it's only sweets that cause dental caries. Yes, sweets cause dental decay, but they are not the only thing. Anything that can become fermented acid in the mouth, because in the mouth there exists normal bacteria and normal microorganisms, and these normal microorganisms, when they react with the food that you have eaten, they produce a byproduct which is an acid. Now when that acid sits on the enamel of your tooth, the enamel of your tooth is this white part of our teeth that we see, the topmost layer. Now continued production of this acid, and that acid being retained on the teeth, on the biofilm of the tooth, and the change in pH of the mouth, or on the tooth actually, slowly demineralizes the tooth. Now, I don't want to use these terms they made. Demineralizing is making it like it loses its strength. Yes, and gradually, it's not something that happens in a day. It is something that is gradual, repeatedly, and that's where I was started from. Its behavior. Yes, it is like like when I say it's like it was categorized like an NCD. For instance, for somebody to develop a non-communicable disease, it is years of poor habits that lead to the disease we end up with. So even dental caries, they don't develop in a day. You may find a cavity progresses from the point of view developing the cavity, the actual cavity, to the point of it manifesting as a symptomatic cavity. It could even take 4 or 5 years. But anyway, that is the process. So one of the causes, and I think the causes and the risks almost interplay or overlap.
Okay.
So behavior means it can go dietary, it can also go oral hygiene. Yeah, you may not be partaking of a lot of these very sweet things, or all these fermentable carbohydrates, or these, but then your oral hygiene is really poor. So there is little food residue left in your mouth, but you don't really brush properly, or you don't brush as you're supposed to do, and so the build-up of these bad habits in the mouth are what usually leads to dental decay. I hope that's a satisfactory.
Yeah, it brings out the image, because we have very many parents who have restrained from giving their children sweets and biscuits and other digestives, because they know that those are the only things that cause dental decay, tooth decay. But now, out of this elaboration, I believe that it is now clear it's not only this.
Yes.
And then we've also had other people say that the only challenge is how long someone takes while, for example, having that sweet in the mouth. How true is that?
So the longer, because like I said, there is normal existing bacteria in your mouth, all normal existing microorganisms that are not harmful. They are supposed to be there. Now, the byproduct, what forms actually the acid that is a byproduct of the fermented sweets, the sucrose and fructose and whatever, is what produces the acid that gradually corrodes the tooth. So the longer it takes in the mouth, one of the most prevalent common things, for instance, in children is what we call bottle caries. And bottle caries are usually, you know when you're putting your child to sleep and maybe they sleep with a bottle of juice in the mouth, yes? So that child is prone to decay, to caries more because of so many hours of exposure of these sweets or these sweet things or these fermentable foods, foodstuffs in the mouth. Let's say the milk or the juice or whatever. So the longer it is there uncleaned, the more hours of the action of the bacteria and the food, and then the byproduct corroding the teeth.
Okay.
Yes.
So is there something I should do in order to, first of all, prevent these caries from my teeth from decay?
Still, prevention is mostly, okay, I'll take you through the most basic ones. One, proper oral hygiene. Now, proper oral hygiene, it involves how you brush, when you brush. And by the way, this should start from the moment a child, or the moment a child, some say as soon as, the child, like teeth start forming, it's recommended you clean them at least with a gentle cotton wool. And then the moment the teeth start coming out, you may not be able to use a toothbrush, but these days there are baby toothbrushes all over the place. That's when you start brushing. Brush the proper way. Use fluoridated toothpastes. Yes? And then there is, as an adult, or as usually, for instance, for children, it is recommended that an adult should brush them until they reach an age of about 7 to 8 years. At this point, it is believed they can do a good job themselves. Brushing should last about two minutes. Yeah.
Why the 2 minutes, doctor? Before we leave
the
that?
2 minutes.
Yes.
It's the approximation is you spend 30 seconds per 30, because usually we brush. I don't want to say it. No, I think inattentively, right? We don't do sometimes we don't do brushing with deliberation, with intention, knowing that I'm brushing this side, this is how I'm brushing it. I'm brushing the outside, I'm brushing the chewing surface, so most times we just do because it is routine like. I know when I wake up in the morning I need to brush, so you never really pay
Sometimes
attention.
I'm rushing, I'm late for
exactly.
for work. Yeah.
So you never really pay attention, and then that's how you end up finding people telling you, but doctor, I brush 3 times a day. How comes I'm still getting caries? Yes, I understand you brush 3 times a day, but how is the brushing? That is one. Is it as effective as it should be? Okay. Now that takes me to oral hygiene. The second question is going to be also, what other aspects of your life may be causing this decay? Because the brushing alone may not be enough, right? What are your dietary habits? So some people usually say, and I think I may be digressing, but it's still in line with this. Yeah. Some of the common questions in that line is somebody will say, but you see, in our family, all of us have this problem. It can be one of many things. If we are in a family, if we live in the same household, for instance, chances are very high that our dietary habits are the same. What we eat and also most likely our other oral hygiene habits might be the same. Yeah, because you cannot. I think like we said, this is the family TV. Yeah. The first learning processes start from within the home we are in, but then also finally it is also maybe you're from a family where you have teeth that are genetically predisposed to decay. Like, oh, you're doing all these things because people do not develop decay the same way. Like all of us, like all teeth are not the same. If I'm to say something like that, yeah. So in the prevention, it's mostly still like the risks. The preventions also rely on that, but now we add few things. Regular checkups. The purpose of regular checkups is to show you that much as you do the dietary and and the oral hygiene, a cavity may pop in somewhere, any dental disease may show up somewhere, unpredicted, and it may not be even symptomatic. You may not be feeling any pain, right? In that case, that's where the regular checkups are scheduled. The biannual checkups, the once or twice a year, the intention of that is, one, to remove the tartar that is accumulating on your teeth, to remove the plaque that is accumulating on your teeth, that you have not been able to remove yourself as you're brushing, the microparticles of food that remain over time. And then also to detect if there has been any development. It is usually easier, cheaper to treat any dental disease or any other disease, I would think, when it is just starting.
Okay.
So that is one. There's what we call, and I don't know if I'm going into treatments, but there's what we call fluoride vanishes, especially for children. I know most of our viewers, if not most, there are many young people or children out there whose parents do not know what to do with some of these things.
Exactly.
There's what we call fluoride vanishes or fluoride applications. Now these when decay is just starting, but it has not yet really gone beyond the enamel. There's a chance where it is still reversible. And sometimes even our own, with the fluoride toothbrushes, with good oral hygiene, a cavity may be starting and it stops. And it's what we call arrested caries. So it stops. It's some of those things, like you see grooves in your teeth and you see black shiny lines. They are not sticky. They are not. That was a cavity trying to form. But because of these good practices, it is reversed and it stops there. So yeah.
Okay. Now, you took us through a series of preventive measures. But what about management? Now, I have the caries. I don't know what to do about them. Should I just go so that my teeth is removed?
No. Management is at several levels.
Okay.
So remember, we talked about the yearly checkups or 6 months checkup. A cavity at 6 months is not the same as a cavity at 1 year or a cavity at 3 years. You get? So if you're diligent and you do these checkups as they are supposed to say, I'd say, like at the beginning, at the actual beginning, we do non-invasive managements. Like we don't need actually to do the whole so many things, drilling and whatever. And these are some of the things people fear. Oh, I'm going to go, that machine makes a lot of sound, it irritates me.
And vibration.
Yes. So at the beginning, if it's just starting, like I said, these fluoride vanishes just to arrest the cavity and leave it there. There's something we call fissure sealants. So that our teeth have grooves, like grooves on the surfaces, especially the back teeth. Because if you realize, most cavities start at the back. Of course, some people develop cavities even at the front, and I didn't talk about the flossing in between the teeth, but rarely. So anyway, at the back, at the beginning, we do what we call fluoride vanishes, we do what we call fissure sealants. We cover those grooves that are starting to dig up and become cavities. Then when it has progressed from there into what we call the dentine. The dentine is the most sensitive layer of the tooth. This is where you start feeling when you like slight sensation in the tooth. Yeah. Now at that point we may need to do that whole thing that people hate, the whole drilling thing, and but also I think to reassure people. So, by the way, sometimes some of that can be done with minimal drilling and sometimes without even the injections they fear. You understand? But it all matters like at what level. Anyway, at this level, we try to do the fillings and restorations, because at this point, the hole has a bit widened. It may be possibly visible to you or not, but it may be visible on a radiograph or an X-ray. And at that point, it cannot arrest itself, it cannot stop, it will just progress. So we are forced to remove all the decaying part of that tooth, leave only healthy tooth, and then cement it with some of our materials that we use to do the fillings. Then finally, when the decay now progresses into the pulp, what they call a misuwaje, that's when you're supposed to do a root canal treatment. Now, there is something, some people will say, but they did a filling for me, the tooth remained paining. Chances are high, the hole or the cavity had already reached the nerve part of the tooth. So that's why it continues paining. And the right treatment to do at that point is not to fill, but to first do a root canal treatment and then eventually fill the tooth. When the pulp has been cleaned, the tooth has been disinfected from inside, and then sealed, and then most likely crowned. The last that we discourage, but if the worst comes to the worst, if you are those people who completely don't go to the hospital, you're like, no, I have my tooth this ends, it pains and it keeps quiet, 1 year, 2 years, 5 years, and you come when the tooth has completely disintegrated. At that point, we have nothing else to do but painfully we will take out your tooth. But that is not what we love to do. In fact, most people call us, bakuzi ba mai.
Exactly.
No, it is not what we love to do. And nothing, in fact, let me say this, nothing is better than your natural tooth. If there is anything that can be done to save that tooth, of all those treatments I've talked about, at whatever level you are, we always try to do that. Unless it is absolutely unsavable, if it is spoiled, if it's broken into the roots, if it's decayed into the roots, then at that point, we remove it.
Doctor, we look at, for example, that image on screen.
Yes.
That is so common among children.
Yes.
But we've also seen old people having that. Is that also part of the tooth, the dental caries we are talking about? Yes.
Now this is actually very common among children.
Yes.
Now from this image, if you see, if some parts of these of the decay on this child's teeth, some of it's arresting itself. You see the darkened bit.
Yes.
When the enamel is trying to decay, but then because of I think the fluoride toothpaste or maybe fluoride application, it starts to darken, and the softer tissue of the decay, dies out. So the harder and the darker it becomes. However, it is difficult for you as a parent to know whether it is just being arrested or it's completely decaying. This is for the dentist to help you. In fact, now in such an instance, somebody will ask me, but now you look at this, what will you do for my child? Usually for a child, depending on how old they are, how compliant they are, because for a child, you cannot predict how they are going to behave or react. In this case, our first line of management is usually just the fluoride vanishes. There is to arrest the decay without stressing the child so much, taking them, because if we say we are going to do fillings of those, I don't know how many 3-year-olds will sit in the chair and you try to do any of these. So for children, mainly we try to manage in the best way without, I think, irritating them so much to hate coming to the dentist. But that is it's part of dental decay. It is manageable, and by the way, sometimes you can apply those the fluoride vanishes to a point where it's so hardened you can now easily apply like white cements to try and cover these fillings without having to do the serious drillings. So this is indeed dental caries. I think I went into how probably to manage this, but this absolutely is dental caries in a child's mouth.
Are there any remedies that you can advise, especially at home, that people can use, or things, lifestyle that people can adopt in order to avoid some of these challenges?
The lifestyles are usually, they are tied to brushing properly, brushing with proper toothpastes, flossing, and then be responsible enough to watch what you eat. Yeah, because those are the most important issues, or the most important determinants, I think, of decay, of caries in the mouth. Yeah, the other bits of visiting the dentist or regular checkups of cleaning, but at home, it's mostly oral hygiene, how you maintain your teeth, how you brush, and then what do you eat. Yeah, stay away from things that you know increase the risk of tooth decay.
Okay. So when you talked about people minding what they eat, are there foodstuffs that are good for our teeth? That when you eat these, or maybe you eat these vitamins, they are good for your teeth?
Not necessarily, because you see, the teeth you have, start forming way before you're born. So once you're born, you're supposed everything that harms the teeth at that point. When you're not yet born, that one you have no control over. Yeah, that's why actually pregnant mothers are usually encouraged to consult with their physicians. There are certain medications they are not given, that can seep through and affect the teeth of the baby. Yeah. However, when you're grown or not even grown, as long as you have developed teeth, everything you have to do is now. Now, there are not specific foods that are good for your teeth. Yeah? And I'm not saying there are specific foods that are bad for your teeth. Yes? Everything should be done in moderation. Because if you say sugary things increase the risk of caries, I don't want people to go and start chewing aloe vera because it is the opposite of sugary things. You understand? It is everything you do should be in moderation. If you are a sweet tooth, like some people describe themselves, oh, I love cakes, oh, I love sweets, oh, I love these things, understand the responsibility that comes with those things. Yeah? Understand the responsibility that comes with those things, and make sure that much as you love them, that energy of loving them correlates with your energy in maintaining the hygiene of your teeth, in maintaining how you take care of your teeth, how often you floss, how often you get them cleaned, how often do you visit a dentist. Yeah, so that there is no imbalance. Yes.
Well, we are taking a short commercial break, and when we return, we are starting from there. Kindly stick with us.